Assalamu alaikum, everyone, and welcome to a new session from MAV Health and Wellness Committee. I'm your host, Asma Shweb. I hope everyone is keeping safe and getting ready for the blessed month of Ramadan. As this month is approaching, I would like to remind myself first and then everyone else that Ramadan is the best time to bring mindfulness into our daily lives. For example, being aware of the moment while doing your prayers or offering your recitation or choosing a healthy iftar or sahur recipe. Moment in can reduce the level of stress in our daily lives and bring emotional and spiritual benefits to our lives according to the studies. So please start practicing and inshallah make this Ramadan more beneficial than ever. Now we will move on to our very sensitive topic of today, that is the substance use disorder. According to the data by the World Health Organization, around 246 million people in the world use some sort of drugs. And out of those 246 million, 27 million people will develop some sort of substance use disorder. Unfortunately, this disorder is not uncommon among Muslims communities around the world and in USA. Whereas, of course, as we know that recreational use of any sort of drug is clearly haram in Islam. So now the question arises that what can we do as an individual to fight this danger or to eliminate this from our communities? And to answer these questions, I have invited a licensed clinical social worker, Ms. Komal Bhutto. She will share some facts and myths about the disorder and shed light on how we can eliminate this and what are some of the treatment options. So first of all, welcome Ms. Bhutto to our community. It's really great to have you.
Thank you.
Please introduce yourself to our community first. Let us know what you do, and inshallah, then you can start the topic.
Okay, perfect. Hi, assalamualaikum. I'm Komal. I work at a substance abuse treatment center. So we have mental health and dual diagnosis programs for adolescents and young adults. And I am the lead clinician there. Should I just go ahead and open my presentation?
Yes, please. Yes.
Okay, perfect. So I'm going to share my screen. Okay, let's do from beginning. Can you see it okay?
We do. And
okay.
I would just like to let everyone know that if anyone has any questions, they can post it on the comment box on the Facebook presentation, or they can also email me at health-wellness@darunoor.org. And Ms. Komal, you can start.
Okay, perfect. So some of the myths and facts that are related to the substance use. The first one, pretty much, you can stop using drugs anytime, right? Withdrawal sickness, believing you must have drugs, and then being around people who you use can make stop drug use difficult. But there are people and programs that can help. I think it's really difficult for people to just stop using on their own. They might for a day or two, but then they could go through withdrawal symptoms. And that's really, really dangerous if they, especially depending on what kind of drugs they're using. Another myth is you have to use drugs for a long time before they can really hurt you. No, that's wrong as well. Drugs can cause the brain to send wrong signals to the body. This can make a person stop breathing, have a heart attack, or go into a coma. And this can also happen the first time the drug is being used. The next one is if you smoke pot on the weekend, you'll be fine by Monday. That's wrong too. The effects of pot can last up to 3 days. Impairs your memory, your reflexes, and coordination, and among other things. One of the other myths that we hear is drugs relieve stress. They help deal with problems. That might happen for, a short term, but that's not the long-term solution. Drugs only make people forget and not care about their problems. But when the drugs wear off, the problem is still there. More myths. As soon as a person feels normal, all the drugs out of the body. No, that's not the case. So long after the effects of the drug stop being felt, the drug is still in your system. So for example, cocaine can be found up to 1 week and marijuana up to 3 months after a single use. And I've seen this at the Sandstone Treatment Center that we work at. There, I would have clients who stop using and they've been there for 2 months, but they are still testing positive for their drug testing because they still have, for example, marijuana in their system. Addiction only happens to certain kinds of people. That's a big myth as well. Addiction can happen to anyone, no matter their race, their upbringing, their personality type, or, for kids, their GPA.
one of the last myth, there's more, but this is the last one. People can't force someone into treatment. If treatment is forced, it will fail. That's not true either. Treatment doesn't have to be voluntarily to be successful. People who are pressured into treatment, let's say by their family, their employer, or the legal justice system, are just as likely to benefit from treatment as people who voluntarily go. People are often able to think more clearly as they recover, which can help foster change. All right. Let me know if I'm going too fast. I'll slow down. So let's talk about teens first. Alcohol, marijuana, and tobacco are substances that are most commonly used in adolescents. So by 12th grade, about 2/3 of students have tried alcohol. About half of 9th through 12th grade students reported having used marijuana. About 4 in 10 people, so 9th through 12th grade students report having smoking cigarettes. And then among 12th graders, close to 2 in 10 reported using prescription medicine without a prescription. So they could be, getting the non-prescription medicine from their friends, employers, stealing from their parents, stealing from their family. And that's really common too. We've seen that a lot, that once kids get addicted, they do resort to stealing. All right. Some of the risk factors. So insufficient parental supervision and monitoring, lack of communication and interaction between parents and kids, poorly defined, poorly communicated rules and expectations against substance use, inconsistent, excessively severe discipline. So we've seen this go wrong way too, right? There's parents who are overly protective of their kids and then who are not protective of their kids at all. So it goes both ways for the kids who are using. A lot of family conflict, favorable parental attitudes towards adolescent alcohol and drug abuse, and then parental alcoholism or drug abuse. So if you have a parent who's likely drinking or using drugs, there's a chance the kids will pick that up as well, and they will likely use. Some of the other risk factors, I would say high sensation seeking, impulsiveness, psychological distress, difficulty maintaining emotional stability, perception of extensive use by peers, perceived low harmfulness to use. So by that, like one of the main ones, their peers, their friends, they're all using, and it's all there is accessible for them. They can get it from their friends, or they have older friends who are using. So this, that's one of the risk factors, is the people that you hang around with and who you're around with as well. That's really, really big one. So next is for young adults. In 2018, we saw that there was an estimated about 34.1 million young adults that were using. And more than 1/3 of these young adults reported binge drinking, so having 5 or more alcoholic drinks in a row. And then about 2 in 5 young adults were using illicit drug use. And that could be cocaine, that could be crack, heroin, opiates, benzos. So 1 in 11 young adults is a heavy drinker. 1 in 10 young adult, and young adult is from 18 to 25. Normally, typically for us, when we say young adult, it's from 18 to 30. 1 in 10 young adult has an alcohol use disorder. 1 in 7 young adults have a substance use disorder. 1 in 13 young adult has illicit drug use. 1 in 17 young adults has a marijuana use disorder. And then lastly, 1 in 100 young adult has an opiate use disorder. I also like to say this data is from 2018. I tried finding more recent ones, but didn't have a lot of success with it. But I feel like over the past few years, it has increased trifold just because of the pandemic, and people are living, through a really tough time. They are not used to it. So drugs is one way to resolve some of the problems they're facing. So what sort of drugs? So approximately 1 in 4 young adults use hallucinogens. So that could be LSD, PCP, mushrooms. 1 in 17 young adults use cocaine. 1 in 18 young adults misuse opiates. So that could be heroin, oxycodone, morphine. And what I've seen lately, a lot of it, the oxycodone, a lot of young kids are using cough syrup. and mixing it with other things, and that's what they get the high from. So really, a cough syrup is a really misused substance as well. 1 in 22 young adults misuse prescription benzodiazepines, so Xanax, Ativan, Klonopin. If they're prescribed Xanax, for their anxiety, and Ativan for their ADHD, a lot of these kids or young adults are really, really misusing that. 1 in 125 young adults use methamphetamine, so that's meth, and then 1 in 200 young adults use heroin. Dual diagnosis. So substance use, in my what I believe is normally goes with a mental health disorder. In 2018, there were 2.4 million young adults diagnosed with both a mental illness and a substance use disorder. So according to the National Institute of Drug Use, 6 in 10 substance abusers, teens, also had a mental disorder. So one way is, let's say if they have depression, they have anxiety, bipolar, they're going through a tough time. One way they self-medicate is by resorting to drug use. And that's really, really common to see. A lot of kids have both a mental health disorder and a substance use disorder. What to look for. So for parents, even like family, friends, whoever, their support system, what should we look for? Physical evidence of drug and drug paraphernalia, behavioral problems and poor grades in school, emotional distancing, isolation, depression, fatigue, changes in friendship, or, they have new friends that you never knew before, and you're just like they're hanging out with them all the time, and they're extremely influenced by their peers. Hospitality, irritability, change in level of cooperation around the house, lying or increased evasiveness after school, or not telling you where they're going on weekends or even after school, decrease in interest in personal appearance, physical changes such as bloodshot eyes, runny nose, sore throat, frequent sore throats, and rapid weight loss. That's a really big one as well. Changes in their mood, their eating, or their sleep patterns. And then dizziness and memory problems are also something that can occur as well if they do stop using the drug and they're going through the withdrawal symptoms. And some of the treatment options are support groups. So there's AA, which is Alcohol Anonymous, and then we have NA, which is Narcotics Anonymous. So those, you can find an AA meeting honestly anywhere. There's so many locations, and a lot of them there's Zoom as well. So if you can't make it in person, there's Zoom meetings, and there's NA for Zoom and in person. Dual diagnosis facilities. So where I work at, we have mental health programs and we have substance abuse programs for kids and adolescents. So the ones that just touch on both, because not everyone has a substance use disorder. Not everyone has a mental health. Sometimes it's comorbid. So there is that. Rehab would be something that if, let's say, a child or a young adult drank a lot, and they got really sick and they had to go to, there's rehab facilities, but then they go for detox. So they go to inpatient hospital for a little bit just to, detox, get that out of their system. And then from there, they'll go to rehab, like a facility such as residential, which is, they would stay, typically residential stays about 45 to 60 days. And they live there with other teens or young adults, whoever they might be. Sometimes it's co-ed, sometimes it's not. And they get group therapy, they get individual therapy, they do activities together, they learn the coping skills to stay sober and to not self-medicate with drugs. And then PHP and IOP, I work in the PHP one at Sandstone. So PHP is partial hospitalization program. That's when they are still they need help. They need a lot of help. So if let's say they go to residential or they are inpatient hospital for a few days, then they'll step down to our program PHP, which is more intensive. So it's about 25 hours a week. And, For some people, they're like, oh, I might not need help. So they haven't come to terms with it, or they just need a lot of help depending on how much substance they've used and for how many years, and, depending how many substances they've used and the length of the time, they might need a more intensive program that can really meet their needs and see them 5 times a week. And then IOP is intensive outpatient, and that one typically is usually 4 days of programming, and it's less hours as well. And that one, once they do PHP or they've gotten help somewhere else, and their drug history and then their substance use and the length of the time they've been using is not as intensive, then they can step down to IOP, and that one's typically about 8 weeks. So those are the options. And then there is also family therapy and individual therapy. And we highly recommend, once, if people are in our PHP or IOB program or even anywhere else, that they still should have an individual therapist that they see weekly or every other week, because you don't want them to have any support. Where they were in residential for a while, they were in inpatient, they had all this support. And then once they come back home, we don't want them to not have anything. They still need to see a therapist. They still need to see a psychiatrist. They still need that additional support to learn the coping skills and, maintain that. I already mentioned ANA meetings and sober living. This one's more for adults that are, for example, their family doesn't want them to stay with them anymore just because of the drug use they're having, or, they lost their job, they don't have a house anymore. So sober living is they live there. It's separate for men and women, and it's usually about, I think, 8 people or 10, depending on how big the house is. And the people at the house, so the manager, the team, they work with them to get help to get them back on their feet. So they would help them get the job. They would help them financially. They give them, they'll provide them food, usually 1 or 2 meals a day, depending on what program it is. And they, along with sober living, they would also attend either a PHP or an IOP program somewhere. So those are the requirements for sober living, that you have to be in a treatment while you live with that in that house. Okay, I think that's it. And those are my references. So I'll stop sharing.
So wow, the numbers are alarming, Kamal, first of all. Yeah, it's more than you imagine. It's much more than we imagine. We take it very lightly, especially in the Muslim communities. We have a myth that Muslim kids cannot do drugs, or they will not do drugs because they have so many protective factors. But still,
right.
I'm sure in your practice, you will see like kids from all walks of life and all faiths and all religions.
Yes, I have. Honestly, like I said, addiction doesn't just go to one person, right? It can happen to anybody, any family. They don't have to be rich. They don't have to be poor. They don't have to come from a certain neighborhood. It can happen to anybody. So I have seen the Muslim population too. And it's growing, I think. I think honestly, with the pandemic, I've seen a lot of teens suffer more and more with having addiction and mental health disorders.
So Komal, the treatment options that you have discussed, like what, if a parent notices something off with their kids, or if a family member, so what is their first mode of action? Are they supposed to call their primary care first and then they refer to, the next step, or they can reach out to these treatment options individually, and most insurances, they take most of the insurances that
honestly, so our facility, we're mainly located in Colorado, so we're expanding to the East Coast and stuff. So we don't accept all insurances. We accept few, but we do work with the out-of-network insurances. For example, Kaiser. We don't accept it, but we do work with Kaiser and figure out the benefits. I have to say these treatment places are expensive. For example, if you don't have insurance, I think for our PHP program, it costs $25,000. Yeah. With the insurance, it does help. I don't know what the cost is, but if you do have insurance, you probably just have to pay, the deductible or pay some out of pocket and then work through that. So yeah, if you do see if you're a parent and you see your child struggling, talk to them first, and then, go through your insurance and see which places do accept your insurance. So research that, talk to your insurance first, and then start calling the places. That's pretty what we've seen is like, our admissions team will just, parents talk to them, and then they schedule the assessments with us.
And usually, like if you see a patient, how long would it take for a patient to be clean, a person to be clean, especially if it's a teenager and they haven't been abusing the substance for a long time? So it depends on person to person. Does it
Yeah.
depend on?
It depends on person to person. And, honestly speaking, we do have people who relapse that go back to drug using. And, that's just, they're good for a while. And then something happens, a trigger happens, some family fight, or they see something and they go back to using. But I think every person's different, and it's how much, that the support they have and how much they really want to change their life. Some people really don't want to go back to the way they were living, and they really want to make the positive changes so they don't, use ever again. But then some people do, and it's just, every person's different.
Yeah. So it's a big. I have a question, Komal, in on the Facebook post. How do we advise kids to help out their friends? What approach do they need to take without feeling as if they are betraying their friends?
Yeah, I would, have an honest conversation with the friend, saying, that we're teens and we're still developing. Our brains are developing. We know everything, but we don't know everything. And, drugs can really take a toll on your life, and they can really make a big impact. And honestly, if, the friends are still doing it, I would talk to the parents, because sometimes, they don't listen to us. Like, we don't listen to each other, and we need an adult figure, especially if you're a teenager. You need an adult figure to tell you, this is wrong and you need help for it. So if the parent is not going to listen, and if they're not going to respond to you, then I would say talk to their parents.
Mm-hmm. And that's a really good advice, because we all know that drug use is like dangerous. We all know, and it leads to death. I did not mention it initially that it takes 400,000 deaths annually around the world.
Yeah.
So it's a huge and dangerous number. So and especially the public health issues, it's better to be prevented than to seek treatment afterwards, which will have other health effects anyway. Even if they are clean, they will have the ups and downs or whatever. So is there something else that you want to advise, especially the Muslim community or the Muslim parents, to avoid these things, or to how to be like really vigilant with their kids and with their families?
Yeah, I think, you just have to take a middle ground approach. We can't be too strict on our kids, but we can't be too lenient either, right? We have to be in the middle and talk to them. What are, the risk factors and what can happen when we use drugs? And if, they are experiencing, they're depressed or they're anxiety, they have anxiety or they're anxious, really get them help. I think the first thing is, if you feel your child is not talking to you and you see the signs that I listed, please get them help, talk to them. Because, mental health is such a stigma, especially like in the Muslim community and the brown culture. Oh, they're crazy. That's what we say, right? We don't get them the help they need. Everyone needs therapy. It's so beneficial because sometimes we don't want to open up to our parents. We don't want to let them know, because we don't want to burden them. That's also a thing, right? We don't want to burden our parents with the things that we're dealing with. So if you see your child, not acting the same when they are, please just get them a therapist. I think that's the first step, is to open up and be like, hey, I see you're struggling. You don't want to talk to me. That's okay. Let's get you the help. And, maybe just going to therapy will be fine. They'll learn from that and they'll open up to that therapist. And, initially, if the therapist sees, okay, they have a substance use problem, then they'll refer them to a treatment center. But it could be just, they're depressed, they're anxious, especially with the pandemic going on. It's a lot of new changes. I would say just really be honest and talk to your kids, and don't make them feel that they're doing something wrong. Because we all, like a lot of kids feel that way. Oh, I'm a disgrace to my parents, or my parents will feel this way if I go get help, or they don't want to be honest with you. So just the matter of just like being open with your children and really explaining to them the effects of drugs and how it can lead to death. And overdose is really common. And kids don't know what they're doing. They might take 2 pills, but then it could really affect their body. So just, I think what I would say, just be open.
And have the discussion. And yes. Do we have any support group for the parents as well when the child is going to therapy? These institutions
yes.
offer support groups for the parents as well, so they know how to handle the kids better?
Yes, we do. So for speaking for Sandstone, we do. So when kids are in our IOP program, we have a multifamily group every week as well. So out of the 4 days, one of the days is multifamily group with our family therapist. So parents come in and they get the support they need, and they can learn, the effects of drugs, how drugs work, and like how it can affect family relationship. What can they do? Coping skills, communication. So we offer a multifamily group as well. And then we also offer individual and family therapy sessions. And I'm sure other facilities do as well. I think it's just part of like how we can make the treatment better, the whole process. So I'm pretty sure they would offer family therapy and individual therapy and the multifamily groups. We also have, Sandstone has, you don't even have to be a part of, to join us. They have a virtual parent support group. Even if you don't have a kid in the facility, I think you can just go on the Zoom link and join for the virtual parent support group. And I think it's free. But there's all on Psychology Today, they do have support groups. If anyone would like to see, I think they would, if you just search support groups near you, you can definitely find out family support groups.
Okay, thank you. Thank you so much, Komal. It was like really informative and really an eye-opening, especially I will say again, the numbers were alarming to me even, like because when you say the numbers at large, it's like millions or 100, but when you calculate it like 17 in 10,
right,
1 in 17 or 1 in 10, that's a dangerous number, and it means this is very close to us.
Yeah.
Like this disorder in our network, we will have kids or adults going through this. And I really hope that people who are watching will share this presentation so people know how to seek help, especially within the mosque or within the Muslim communities. And as Komal said, please do not hesitate to go out and seek. First of all, admit that there is a problem and then seek help. And as a parent, as an adult, or as a child, it's okay to seek help when you need it. We don't need to hide it. This is considered a stigma, and it will be considered a stigma. We don't know until when. But if you know it, you better act on it before it's too late. Thank you so much, Komal, for your time.
Thank you for having me.
Thank you for your presentation. It was very informational. Thank you. And everyone who's watching, if you have any questions, you can, we are ending this session right now, but you can always email me at health-wellness@darunnoor.org, or you can use the community WhatsApp group, or leave a comment in the Facebook, the presentation that's going on the Facebook. And Komal, if you have any resources that you would like to share with the community and you think that people can benefit from it, please send it to me and I will post it on the comment box as well, and we'll share on the different WhatsApp groups.
Perfect. I will. Thank you.
Thank you so much. Thank you everyone for watching. Stay safe. Happy Ramadan in advance. Have a blessed Ramadan, inshallah. Keep everyone in prayer and stay safe. Assalamu alaikum.